Welcome to Lasting Lifestyles, a support program for caregivers and families. Hello, I'm Janet Corbally, Director of ViBridge Connections, and I'm very pleased to have joining me Dr. Alan Nasar, who is an orthopedic surgeon from Western Monmouth Orthopedic Associates.
Good morning, Janet. Thank you.
You're welcome. Dr. Nasar, it's really a whole new world out there when we're talking about alternative treatments and really integrating, Eastern and Western medicines to really help improve individuals' quality of life. And when we think about the condition of arthritis and what are some of our treatments that may be available out there in dealing with this particular condition, so it's really great for us to get a medical perspective on what is really involved with these treatments and how we can work together. But I think it's very important for us to really understand what is arthritis.
Right. So arthritis is wear and tear or degeneration of your joints. It could be any joint in your body, from the fingers, knees, hips, spine, and it generally affects older Americans. They say half of Americans 65 and older have arthritis affecting one joint. There's another kind of arthritis called rheumatoid arthritis, which is very different. It's actually an autoimmune disease where the body attacks the lining of the joints in your body, and that causes swelling and pain as well. And that can affect younger patients, but it's not as common.
Now, what are some of the traditional treatments for arthritis?
Sure. The traditional treatments, they start off with acetaminophen, pain relievers, anti-inflammatories such as naproxen or ibuprofen are commonly prescribed. Generally, we advise weight loss if the patient's overweight, activity modification, things like that. That's the conservative route.
Now, are there specific limitations to these traditional treatments? And what they can actually do for
yes,
a patient?
Certainly, taking acetaminophen or Tylenol, only provides really mild pain relief. The anti-inflammatories, unfortunately, all have serious side effects, and so some people can't really take them. They get upset stomachs and things like that, and sometimes they don't work. Weight loss, yes, I mean, it's easier said than done. So, a lot of patients don't find that those treatments are very helpful for them.
So, as a physician, you're always, I'm sure, trying to seek ways that really can kind of work for that particular individual, because everyone, as we know, has got their own uniqueness in what works for their own bodies. So what are some of the alternative treatments that you would suggest to your patients?
Well, before we get into, let's say, injections, because that's in my next line, there's cortisone injections and other injections into joints, but it's not good. That doesn't not effective in every joint. Before we get into that, because that's a little more invasive, that requires a needle, and not everyone likes needles, I generally recommend glucosamine and chondroitin sulfate. This is an alternative treatment that's been around for a while and is now becoming more accepted by the medical community since there's been recent publications showing that it can be as effective as one of the leading anti-inflammatories in helping patients with arthritis pain, and the side effects are really minimal.
Are there other alternative treatments that are available? Other modalities that individuals can look into?
You're talking about things you can take by mouth, so that's like glucosamine. Ginger is an alternative treatment widely used, which can help with pain. And then we talk about, let's say, diet. We find that a diet high in omega-3 fatty acids, which could be, let's say, fish oil, flaxseed oil, can help with inflammation in the body, and other things like exercises such as yoga or tai chi can be very helpful with patients and have been proven to be helpful with patients with arthritis, and these are practiced widely around the world. Other modalities are something like acupuncture, also very good for a lot of different ailments, including the pain from arthritis.
Let's as I said earlier, it's a whole new world out there as far as the other healing modalities that we can look into working with our physician. I think that's very important, is the communication, and to really journey together, so to speak, with your doctor, so that you're learning what works for your body. Yes. And so if you are open to yoga and to Tai Chi and these other supplements that you're describing, before you go into the actual needles and surgeries, and you know, you really want to try and holistically.
I like my patients to take an active role. I mean, that makes me feel good. If they're enthusiastic about getting better and they're willing to go, and you know, it's not the easiest thing to go to a yoga class or learn about these alternative healing methods, but if they show me that they're interested, that excites me to even get more involved in their care and getting them better.
Now, are these additional, like going outside of the traditional treatments, are they very costly?
Some are, some aren't. I think the most effective things are not very costly. You can find classes, exercise classes and things at your community center for, a very small fee. Glucosamine chondroitin sulfate has a moderate price tag associated with it, but it's not prohibitively expensive. Most people can afford it. Something like acupuncture is going to cost, maybe $100 a session or maybe a little less, but you can get your insurance company to cover it possibly. Most things you can manage if you through your insurance or if you comparison shop, you can get a good deal on certain supplements.
And what's also wonderful, some of these treatments, these alternative treatments, you can do at home.
Yes.
And you can, purchase videos, and really the most important, I think, turn here is that you're open to new ways of integrating what is out there as far as other healing possibilities.
I do like my patients to get out there, though. I like them to meet other people with similar problems. I find that that's very therapeutic as well. So it's good to get out there, go to your local community center, and do exercise classes in a group session, because the group, really does have benefits additional to just the exercises.
And very supportive. Very quickly, is there anything that you would recommend people staying away from?
The main thing, my main concern with patients is if they're taking supplements that they don't know what the ingredients are, and they don't tell their physicians that they're on them, and they may not know the interactions with other medications, that can be potentially problematic. You can get very sick. So if you're going to get supplements, make sure you get reputable companies, you know what the ingredients are, and run it by your physician.
Great advice, Dr. Nasar. Thank you so much. It's a whole new world out there in healing.
You're welcome. Thank you.
You're welcome.